So I'm ready now because I have obtained an order to catheterize Mrs. Jordan. And so I'm just going to go in and introduce myself and let Mrs. Jordan know that I'm going to be inserting an indwelling catheter. Hi, Mrs. Jordan. My name is Judy, and I'm your nurse today. And I have an order from Dr. Jones to put in a urinary catheter because I understand you're having difficulty emptying your bladder. So first I want to do is just make sure you understand that urinary catheter shouldn't hurt. It can be a little uncomfortable during the process of having the catheter put in, but you should feel some relief afterward. So I've checked your armband with my doctor's order, and I'll give you one more opportunity to empty your bladder before we actually put in the catheter. Oh, I see. You've already tried. Okay, well that's great. Then I'm going to get started then. I've got the bed raised at the level that I need it. I have my order and I've checked it with Mrs. Jordan's armband. I have my catheter tray, and this particular catheter actually has the pre-filled syringe with sterile water to inflate the balloon, and it also has the cleaning solution and the sterile gloves. To ensure that we don't contaminate Aaliyah's bed linen and have to change that again, I'm going to get a blue soaker pad that I can put underneath her to save her linen. I have a urinary drainage collection bag as well, and although the catheter tray actually has a pair of sterile gloves, I like to bring an extra pair, as well as I have two catheters in case I contaminate one. I always have a backup one. And I have some tape to secure the catheter to the inner aspect of Aaliyah's right thigh. And sometimes some agencies have what we call a flex track, which can be used as well, but we don't have any in this particular agency. So before I get started, I'm going to secure the drainage bag to Aaliyah's bed frame, not the bed rail, because the catheter must always be sitting below the level of her waist. So I'm going to secure that to the bed rail. Oh, and before I do, I'm going to make sure that the flange at the bottom is in the closed position so that when the urine drains into the bag, it doesn't drain out. This particular drainage bag has a little clip halfway along the tubing that can be moved wherever it needs to be, and it actually helps secure that drainage bag tubing to the bed linen so that it doesn't fall onto the floor. And then I'm going to actually put the tubing here. The tip of this drainage bag tubing needs to stay on because this is sterile. This tip will connect to the lumen at the end of the catheter. Okay. So, Mrs. Jordan, I'm going to pull your linen back, and I'm going to expose you for just a few minutes here while I get ready to set up my tray. I'm going to put the blue pad underneath to save your bed as well. Okay, And I'm just going to leave this down for just a few minutes. This is not sterile, the blue blue pad is not sterile. Okay, so now I'm ready to start, and before I do, I'm going to sanitize my hands. And when I'm ready, Mrs. Jordan, I'm going to have to expose you for a few minutes and pull your gown up. So now I'm going to open my catheter tray. I have Mrs. Jordan all set, and there's usually a perforated edge at the one end of the catheter packaging, which I have there. And I'm going to keep this bag here and put it at the bottom of the bed in case I need that for any garbage. So I'm going to open up my tray, but before I do, I will tear off a piece of tape that I can use to secure the catheter to the inner aspect of Mrs. Jordan's thigh. I'm going to hang it right on my table. Otherwise, you can use what we call a flex track. We don't actually have any in this agency at this time. So I'm going to open up my tray, and I'm actually going to pull it taut away from me. And I'm going to be careful to remember to touch only the outer aspect of the tray and the 1-inch border. Underneath this little flap is the pair of tongs that you're going to need. So I'm going to take them in my right hand, and I'm going to use them to help me square off my tray. Okay, and I'm actually going to move my tray over a little bit so that I can extend my sterile area there. Now the tips of my, when I put the forceps down, I have to ensure that I put the tips inside the tray past the 1-inch border. But before I do, I'm just going to remove some of the items on my tray so that I can access my gloves. So I have a drape that I'm going to put over here, and I'm going to lay my gloves right here that I can use. And I'm going to put my other tray there, my other drape there as well. Now, within the tray, there's a number of items. There's your gauze to clean, there's the cleaning solution, the pre-filled syringe, the lubricant, and a specimen sample bottle. I actually don't like to touch the inner aspect of that tray until I have my gloves on. But you can do that. If you prefer to move the contents around with these tongs, you can do that as well, whichever works. As well, there's another pair of tongs inside. So I'm going to lay these down now, ensuring that the tips are beyond that 1-inch border, so they are going to remain sterile. And now I am going to add my catheter to my tray. There's a couple different ways that you can do this, and again, you want to make sure of the expiry date on the catheter, and you want to make sure you know how much fluid can be used to fill this syringe as well. So I'm going to peel this open, and the few different ways that can be done to open the catheter and get the catheter onto the sterile field. You can open up the catheter and then deposit the catheter onto the tray. You can open up the packaging and lay it beside you, and then pick up the catheter with the tongs. Or the way I prefer to do it is to open the catheter packaging like this, ensuring that you are not touching the tip of the packaging. Then with my sterile tongs, I remove the catheter and put it into my tray, like that. Now I'm going to expose Mrs. Jordan, and I'm going to ask her to put her legs, her feet together like a frog-like position, and I'm going to expose her. And from this point, Mrs. Jordan, you're going to have to stay very still because I'm going to put my drape on, and from this point forward, everything below your waist will be sterile. I'm going to sanitize my hands again. And I am going to don my sterile gloves. So my dominant hand first. And then my non-dominant hand. Okay, so now I have my sterile gloves on. I can touch anything in my tray with both hands. So I'm going to, again, this catheter packaging is perforated so that I can pull the catheter out. And I want to make sure that I keep it as close in my hand like this so that it doesn't swing around and get contaminated. Then I'm not going to need a specimen today, so I'm going to put this specimen container over here because I don't need it. I can pick up my whole tray and I can check that I have my container with my cotton balls. And I'm going to, this particular catheter tray has betadine in it, iodine, so I'm going to open my packaging and I'm going to pour it onto my cotton balls, saturating them. Okay, so I'm going to have done that. Then I have my sterile forceps, which I'm going to sit inside the container with the cotton balls that are soaked in my iodine. I'm going to open up my lubricant because I'm going to need that to lubricate my catheter. So I'm going to put that lubricant on the edge of my tray so that I can roll my catheter into it. And finally, I'm going to hook up my catheter, the syringe, onto my catheter. Now, the new edition of Canadian Fundamentals suggests that we do not test the balloon at the tip of the catheter. But in the previous text, so in the revised 4th, Potter and Perry suggest that we do test the balloon at the tip. That would also depend on your agency. So your agency may recommend that that balloon is tested first, and yet the new practice in the 5th edition of Canadian Fundamentals says we don't. But if your agency suggests that you do, it's important that we just push the tip of the syringe, and basically when you're testing the balloon, you're testing that it fills just as this does without leaking any fluid. So then you just let the syringe come back, and that's been tested. So keeping the syringe on the end of the catheter, I'm going to roll my catheter in the lubricant, and we are going to, for Aaliyah Jordan, we are going to insert the catheter 5 to 7 centimeters. So we want to make sure it's well lubricated. So I'm putting that in my tray. Now, Mrs. Jordan, I need to drape you. I have two drapes. The first drape has a shiny side and it has a not shiny side. And for the sake of my bed linen, I'm going to actually put the shiny side down to save it. So to do that and to make sure that my hands don't get contaminated, I'm going to fold the corners in and have it more of a rectangular shape. So I'm going to ask Mrs. Jordan to lift her bottom, and I'm going to put the drape between her legs. Careful not to touch anything but the drape with my sterile gloves. Next, I'm going to put the diamond-shaped drape on, and some people prefer not to use this drape. And this drape, again, I'm going to just lay over top, so just her labia and her meatus are exposed. Again, making sure that I only touch the drape itself. Now I have extended my sterile field, so I am going to pick up my entire tray and I'm going to put my tray right between Mrs. Jordan's legs. So Mrs. Jordan, I'm going to put this tray there, so it's important that you keep your legs apart. So if you felt that your client could not be compliant, this would be certainly a time when you would ask for assistance to perform this catheterization. So now I'm going to start by cleaning. I've placed my non-dominant hand, my left hand, spreading Mrs. Jordan's labia. And now I'm going to start cleaning. And as we do in terms of cleaning, we're opposite of that of the incision. So we're actually going from clean to dirtiest, and clean would be on either side of the meatus. So Mrs. Jordan, this is going to be a little bit cold. I'm going to clean on the farthest side first, top to bottom, one stroke down. And then on this side, on my side, top to bottom, one stroke down. And then down the center, top to bottom. Down. Okay, so now I am going to remove my container. I'm going to make sure that my catheter is lubricated and not moving my left hand. I'm going to ask Mrs. Jordan, I'm going to insert the catheter, and I'm going to ask that you bear down just as if you're going to be trying to push some urine out. Okay? So I'm going in and I put the catheter 5 to 7 centimeters. I insert the catheter or until I see drainage. Once I see drainage, which I do now, I extend that catheter 2.5 centimeters a little bit further so we know that we're beyond the neck of the bladder. Then I'm going to take my syringe, and as per the directions on the package, I'm going to fill the balloon at the tip 5 mils. Okay, and once that's done, I'm going to remove the syringe. I'm going to take the drainage bag tubing and loosen the cap, and ensuring that I don't contaminate the tip of the tubing or the end of the catheter, I'm going to secure it to the catheter. There we go. Now I'm going to take my tape and ensure that the catheter is secured to the inner aspect of Mrs. Jordan's leg. In some agencies we have a flexi track to do that. In this agency we just use tape, and I'm going to make sure that it is loose enough that she has some slack if she moves her leg. And that is secured to the inner aspect. Now I'm going to remove that drape. My urinary drainage tray so I can measure the color and the amount of urine. And now I'm going to just provide Mrs. Jordan with some pericare and some teaching now that she has an indwelling catheter.